everyone, let's learn about pain management. Opioid analgesics. Adverse effects of opioids. Gastrointestinal, nausea and vomiting. Usually settles after several days. Give antiemetic either regularly or PRN. If persistent, change to a different opioid. Constipation. Laxatives and dietary advice are required for the duration of opioid therapy. Gastric stasis, metoclopramide or cisapride. Adverse effects of opioids. CNS, narcosis, sedation. May resolve after a few days. Reduce opioid dose. Withhold less necessary drugs that are CNS depressants. Consider an alternative opioid. Psychotomimetic. Reduce opioid dose. Haloperidol. Consider an alternative opioid. Myoclonus. Reduce opioid dose. Benzodiazepine. Respiratory. Severe respiratory depression. Mild or moderate respiratory depression. Reduce opioid dose. Withhold less necessary drugs that are CNS depressants. Consider an alternative opioid. Suppression of cough reflex. Tolerance. Tolerance is a normal physiological response to chronic opioid therapy in which increasing doses are required to produce the same effect. Tolerance is uncommon in cancer patients with chronic pain in whom the need for increasing doses usually relates to disease progression. Tolerance is not a reason for saving up the use of opioid drugs until the terminal phase. Tolerance patients concerned that there will be nothing left for more severe pain should be reassured that the therapeutic range of morphine is very broad and that there is adequate scope to treat more severe pain if it occurs. Physical dependence. Physical dependence is a normal physiological response to chronic opioid therapy which causes withdrawal symptoms if the drug is abruptly stopped or an antagonist administered. Patients whose pain has been relieved by surgical or other means should have their opioid reduced by about 25% per day. Patients should be reassured that physical dependence does not prevent withdrawal of the medication if their pain has been relieved by other means, providing it is weaned slowly. Psychological dependence and addiction. Psychological dependence and addiction is a pathological psychological condition characterized by abnormal behavioral and other responses that always include a compulsion to take the drug to experience its psychic effects. Psychological dependence and addiction is rare in patients with cancer and pain. Even if it is anticipated that pain will be relieved by other means, opioids should not be withheld because of any concerns related to psychological dependence, although patients with a history of drug abuse should be managed carefully. In palliative care, concerns about tolerance, physical dependence, or psychological dependence are never a reason to withhold opioid therapy if it's clinically indicated. Thank you, my friends.